Joining us in the studio today is Dr. Natasha Herz, an ophthalmologist from Kensington Eye Centre and Washington Adventist Hospital in Maryland. I asked her at what age children are first screened.
They're screened the moment they're born as part of that check to make sure that there's no infection in their eyes or cataracts or any other abnormalities that would need attention right away.
And then, from there, from birth, when would the next exam be done?
Well, their pediatrician will continue to check for any abnormalities such as a turned eye and at some point when they're old enough to see if they are following light properly when they're infants and when they can actually follow an object reliably. These are all along the way of the path of what's normal. And at some point when they can actually identify objects, you could check visual acuity. They don't necessarily have to be literate and be able to read letters or numbers at that point, but you can still show them objects and shapes of certain sizes that would let you know if the eyes are working properly. And if there is something that concerns them, they will certainly refer them to an ophthalmologist at that point. But there are school screenings that are done too, and that's right at the start of their education, right when they're 5 years old.
Okay, and then again later, or is that not necessary?
So it's a good idea to do it at 5 years old when they're starting, because at that point, if they don't see well out of one eye, they usually don't know that they don't have good vision. That's the way their vision's always been. And so a little kid isn't going to tell you they don't see well if they think that's normal. So it's a good way to screen them, and it's still young enough that if there is a lazy eye that they aren't aware of, because you can have a lazy eye, quote unquote, that doesn't turn. It can still be lazy even if they look normal. And the one eye is seeing well, but the other one isn't. So that can still be detected and treated as long as they're less than 8 years old. So it's a good time to screen.
Ooh, so there's just that window from 5 till 8 to get that.
Oh, well, as long as they're younger than 8. I mean, it could be treated before 5 years old, too.
Sure.
But yeah, it's a good time to screen for that. And then if they pass at that point, then usually the child will be able to tell if the vision begins to get blurry and it's hard for them to see the front of the room. They usually then can tell you as they get older that their vision's changing.
Things are changing.
Yes.
So what does 20/20 mean?
So 20/20 is the distance at which they've determined that a normal eye should be able to see a certain size of an object from 20 feet away. And so that means that if you have good normal vision, no refractive error, meaning you're not near or farsighted, that at 20 feet you should be able to see that object. But let's say you don't have perfect vision and you are 20/40. That means that when you're standing at 20 feet, in order to be able to see the object, that a normal person can stand at 40 feet and be able to see the object. So it's a measurement of how sharp your vision is.